to take this opportunity to welcome everyone on board so that together we can study epistaxis. Now, epistaxis is a medical term that means a nosebleed. Nosebleed happens when one of the blood vessels in the lining of the nose bursts. Bleeding from the nose is common in children and is usually not serious. But when it becomes very serious, that is, it's prolonged, and whatever the first aid that you give it doesn't seem to stop, then seek medical attention. The blood vessels in the septum, that is the firm tissue between the nostrils, which divides the nose into two halves, are fragile and can burst fairly easily, causing a nosebleed. In children, the nose tends to bleed from only one side, that is unilateral. Children usually grow out of the condition. If the bleeding is very heavy, prolonged, or does not stop with first aid measures, then, as I said earlier on, you need to take your child to a doctor or a hospital emergency department. The following are the symptoms, that is, the signs and symptoms that will indicate to you that a baby or a child or even an adult has a nosebleed. They include bleeding from either or both nostrils. Number two, a sensation of flowing liquid at the back of the throat or the urge to swallow frequently. What are the causes of nosebleeds or epistaxis? A nosebleed can be caused by a range of factors, including 1. Fragile blood vessels that bleed easily, perhaps in warm, dry air or after an exercise. An infection of the nose lining or the sinuses or the adenoids can cause a nosebleed or epistaxis. An allergy that causes hay fever or coughing can result in the nose blood vessels bursting and as a result causing a nosebleed. An accident, e.g. bumps or falls, or even during a boxing match, the blood vessels lining the inner side of the nose can rupture, resulting in a nosebleed. Sometimes an object can be pushed into the nostril, especially with children or when people are fighting or in a fight. Nose picking, especially when there is some kind of coughing or flu, can result in a nosebleed. Occasionally, a bleeding or clotting disorder can result in a nosebleed. Normally, if an individual has a clothing problem or a bleeding disorder, then we encourage the casualty or someone who is under the casualty to take the person to the hospital because it will not just go away easily. So, what are the first aid management for nose bleeding? Now, to manage a nosebleed, this is what you need to do. First of all, you need to be confident and reassure the person, especially children, as crying increases blood flow. Number two, sit the person up straight and instruct him or her to drop their head slightly forward. Then apply a finger and a thumb pressure on the soft part of the nostrils below the bridge of the nose for at least 10 minutes. So, this is where patience and reassurance is really needed. You need to pinch the nose for at least 10 minutes. Encourage the person to breathe through to their mouth while the nostrils are pinched, okay? Because An individual or a casualty who is bleeding needs to breathe in and out. Okay. Now loosen tight clothing around the neck. Place a cold cloth or cold pack over the person's forehead and one around the neck, especially around the sides of the neck. After 10 minutes, release the pressure on the nostrils and check to see if the bleeding has stopped. If it has not stopped, again for the second time, pinch the nose for 10 minutes. Normally, if the bleeding persists even after doing the first 8 steps, that is pinching the nose for 10 minutes or more, then now seek medical aid. Tell the person not to sniff or blow their nose for at least 15 minutes and not to pick their nose for the rest of the day. Having a nose full of clotted blood is unpleasant, and children in particular may find it difficult to avoid sniffing or nose blowing for a few hours. 15 minutes will at least give some time for the clot to stabilize. You should go to the doctor or a hospital emergency department if the bleeding does not stop after simple first aid management. It is important to find and treat the cause of ongoing bleeding, and that is the reason why you need to take the casualty or the person who has been fallen with this kind of nose bleeding to the hospital where he can be able to be stabilized and managed appropriately. Discuss health for everyday life, pushing back the tide of disease in our world. For health is by choice, not by chance.